I am now.
Okay, so my name is Maria.
I'm Gio.
Ronnie, Ronald.
Sorry, I'm Aaron. I didn't realize we were going in order.
And this is our presentation for special populations. Our client that we chose was a pregnant woman who was about 5 to 6 months along. Prior to pregnancy, she would have a workout schedule of 2 to 3 days a week. Her weight pre-pregnancy was about 45 pounds, so she was about the average weight. And her current weight right now is about 158 pounds. So some risks that come with pregnancy and exercise are that there are sometimes cases where we do have premature contractions early on. We also have an increase in glucose consumptions due to when we exercise, that glucose is being taken from our muscles. So we need to then be able to rejuvenate that. Also with exercise, it causes blood to be redistributed around the body. So there are sometimes reductions in oxygen, and overheating is a big issue because we push ourselves to the limit where we no longer can, and that will affect the woman given that she's carrying an extra weight. Some benefits of exercise when pregnant are that it reduces constipation, backaches, bloating, and swelling. It can also help prevent diabetes. It'll help with sleeping patterns, and it can also help the women get back to shape post-pregnancy. The research study that I found, it was a study where it divided women into different categories. Some did more cardio, some did more resistance training. It was found that those who did the aerobic exercises were safer and it was more beneficial. Unlike those who did the resistance training, it was a lot harder with a higher intensity. And some results of that were they had underweight babies, and there was some slight trauma that could have happened. And it is also more dangerous to do resistance training exercises while pregnant.
So as far as exercise guidelines go, you want to just make sure to start out really slowly and not push yourself to overexerting. And then you just want to also listen to your body. You'll have natural signals that will let you know if you're pushing too hard or not, and what feels right, what doesn't. You also want to wear comfortable shoes for good ankle and arch support. Be careful on rough terrains as well, because your joints do become laxer during pregnancy, and ankle sprains can occur a lot easier this way. Also make sure to take a lot of breaks and drink a lot of fluids. When it comes to weight training, focus more on toning the upper body and abdominal regions for that. Avoid lifting weights overhead or anything that strains your lower back muscles. And then during the second and third trimesters, try to avoid laying on your back as it decreases your blood flow to the uterus. And then I have a graph right here just kind of outlining some more guidelines. This is by the UK Chief Medical Officers. And then you can go to the next slide. And then a study I found was done on female mice. Oh, sorry, something popped up. A study was done on female mice, pregnant mice, and they had them randomly assigned to cages with locking and unlocking wheels to spin on to basically mimic either what would happen if the one population didn't work out and one population did. And they measured their body weight, body composition, their food intake, energy expenditure, their total cage activity, and then their running wheel activity, all in the offsprings of various ages. And they found that the female rats that did exercise during pregnancy, their offspring was actually more active as an adult. they concluded that physical activity during pregnancy may affect offspring's lifelong propensity of physical activity. And here, this graph that shows also the fat loss that they saw between female mice who did work out and female mice who didn't. And the ones that did keep active actually saw bigger fat loss during that time as well.
So the nutritional concerns and deficiencies during pregnancy, you need to make sure that the pregnant woman is taking calcium, vitamin D, protein, and folic acid, and iron supplements. A lot of these supplements, when you have a deficiency in them, can cause preeclampsia, which would be a high blood pressure during pregnancy. And most people don't notice that they have this until about week 20, but can be seen around like week 32. Calcium helps blood flow through the body and helps send messages from the brain to the spinal cord. It also helps with the fetus to grow their teeth and bones. Vitamin D deficiency links with preterm birth, gestational diabetes, and preeclampsia as well. 10% of pregnancies have the issues of gestational diabetes, which is just diabetes like high blood pressure, or not high blood pressure, high sugar during pregnancy. So another supplement you should be taking is the iron, because since you are having a child inside your stomach, you need more red blood cells to get them the oxygen they need. Folic acid is another supplement that women can usually take through prenatal vitamins. These help with the neural tube formation and actually prevents defects caused when the baby is born between also the brain and spinal cord. Some concerns that pregnancy women have and what they shouldn't be eating during pregnancy is uncooked meat, alcohol, raw seafood, and large consumptions of caffeine. Obviously, alcohol should not be consumed at all because it shows increase in low-weight babies. It can cause stillbirth. It can also cause miscarriages. So no weeks during pregnancy you should be consuming any type of alcohol. Raw seafood is also another big food that you should not be eating during pregnancy because of the amount of mercury inside seafood. So mercury can damage the lung, kidneys, and can cause defects in the neural signals between the brain and spinal cord too, which would cause defects in the fetus. Caffeine has also been shown to increase the chances of low birth and preterm babies. Can cause, a lot of the cases are with neonatal babies after they've been born. So those are just some things that you want to completely stay away from during pregnancy. These are just two little charts that I found on the internet. It just shows a nice structure of what you should be eating, which is fats, oils, sugars, just the natural healthy foods. You can also eat dairy. I know there's a few studies out there that shows dairy in a large consumption is also bad for the baby, but there's not enough research out there to show why. But you shouldn't be consuming soft cheeses like goat cheese, blue cheese, brie, anything like that, because they have a higher consumption, or they have a higher percentage of listeria, which is a bad bacteria that can cause damage to the fetus. But you still should be having 3 to 4 servings of vegetables, 1 to 2 servings of fruits, and all the lean meats, and making sure it is cooked well. And then on the right, just the raw foods, the raw meat, the raw eggs, alcohol, fish, soft cheeses, and these are just things that you can find on the internet, super easy to know, just a general description of what you should and should not be eating.
So Whenever you're creating a exercise nutrition program modifications, basically for the exercise modifications, you're going to need to make sure these exercises are not high intensity. You want to make sure they're low to moderate intensity. And some of these modifications can include walking, swimming, you have water workouts as well, and make sure to put some yoga in there. Low impact aerobic classes as well, adding some strength resistance training, aka weight training. And we need to make sure with that the weight is not going to be too heavy. And with the nutrition programs, you basically want to avoid foods that have too many calories, too much fat, and sodium. So some of these foods that you can include into your nutrition program include whole grain foods, include lean meat, reduced dairy fats, vegetables, and fruits. And then one nutrition program that's pretty popular, that's been coming out, is called WIC. And basically, it provides nutritious foods to pregnant women, women of low income, infants, and children up to the age of 5. And you use WIC whenever you go grocery shopping, and whenever that happens, WIC gets applied to it. Go next slide. And then here I got 2 studies. The first one is a study that was conducted in 2018 that looked into dietary modifications for women during pregnancy. And what they found is that the most common reason cited for reducing or eliminating specific foods or groups of food included were the health of the baby, the concern of the baby, aversions, and nausea. And then another study that was conducted showed that because pregnancy increases blood volume, which can include to heart disease or lead to heart disease, diabetes, and cancer, it's important to modify an exercise program that prevents the increase of the blood volume. And then we just have a picture over here of the first study that's shown over here. And you can see the decreased amounts of certain foods, the increased amount of foods, the eliminated types of foods, and foods that have also been added as well. Next slide. We'll just have references right here.